Welcome to today's healthcare channel. As a heart surgeon with decades of experience, I've met countless elderly patients coming in with chest tightness, shortness of breath, or simply unusual fatigue, sometimes just after watering their garden in the morning. But the culprit isn't always aging, stress, or diet. Sometimes the real cause lies in a familiar pill they've been taking for years, often prescribed by their doctor. Many people over 60 take medications that seem harmless on the surface, but quietly weaken the heart muscle, raise blood pressure, or trigger irregular heartbeats in ways you don't even notice. The danger is, these side effects don't appear immediately, but instead build up over time, until the heart finally speaks up. In today's video, I'm going to share with you the 7 most common medications that may be silently damaging your heart. I'm not sharing this to scare you, but to help you become more informed and take a more active role in your own health. Especially if you or your loved ones are taking medications for sleep, pain, blood sugar control, or mood support, then this video is definitely for you. And please don't take your eyes off the screen just yet, because coming up next, I'll begin with a medication that seems mild, but actually carries far more risk than you might expect. Trust me, you won't see it coming. By the way, before we dive into today's content, I'd love to get to know you a bit. What's your name, and where in the world are you watching this video from? Leave me a quick hello in the comments below, because it would truly make me happy and honored to know who I'm sharing this journey with today. And if you find this content helpful, don't forget to hit the subscribe button and turn on the notification bell, so you won't miss any of these simple yet powerful tips to protect your heart every single day. Now let's begin with the first name on the list, a medication that may already be sitting in the medicine cabinet of many households. Medication 1, NSAIDs. The familiar pain relievers that silently become enemies of the aging heart. You're probably no stranger to names like ibuprofen or naproxen. They're commonly found in household medicine cabinets and often used to relieve joint pain, back pain, or age-related inflammation. As part of the non-steroidal anti-inflammatory drug group, NSAIDs, they're the go-to choice for many seniors whenever their joints start complaining. However, what many people don't realize is this. Once you're over 60, your heart isn't as resilient as it used to be, and those seemingly harmless pain pills can actually put constant, silent pressure on your cardiovascular system. NSAIDs can raise blood pressure and cause fluid retention, forcing your heart to work harder to pump blood throughout the body. If you already have heart disease or are on hypertension medication, these pills can make your treatment less effective or worse, lead to arrhythmias or even heart failure. What's even more concerning is that NSAIDs may also damage the kidneys and blood vessel walls, putting your entire circulatory system under continuous strain, and you wouldn't even know it. That's why I always advise elderly patients to be cautious when taking over-the-counter painkillers, especially if you're using them daily as a habit. There are many safer pain management options that don't affect your heart. You just need to ask your doctor for appropriate guidance. Because relieving pain should never come at the cost of your heart. And the next medication I'm about to share is even more subtle. It's prescribed to help control blood sugar levels, but it may be overloading your heart without you even realizing it. Dear friend, if you're still watching the video up to this point, I'm truly glad that you care about your heart health after 60. Please leave the number 1 in the comments below so I know you're still here with me. Medication 2, thiazolidine diabetes drugs, lowering blood sugar but weighing down the heart. If you're managing type 2 diabetes, your doctor may have prescribed you a medication from the thiazolidine group. For example, pioglitazone. This class of drugs is designed to help lower blood sugar by improving the body's ability to use insulin. It sounds reasonable. However, what few people know is that these pills can quietly cause fluid retention, swelling in the legs, fatigue, and in many cases contribute to congestive heart failure, especially in people over 60. Here's the issue. Many older patients already have a high risk of cardiovascular disease. And when a medication increases fluid volume in the body, the heart ends up carrying an extra burden every day without a break. Even worse, symptoms like fatigue, shortness of breath, or mild swelling, which are early signs of heart failure, can be mistaken for normal aging or mild side effects. And so, the heart continues to weaken without anyone noticing. Of course, not everyone who takes these diabetes medications will experience complications. But if you have a history of heart disease, high blood pressure, or are experiencing even slight swelling, It's important to talk with your doctor about the possibility of switching to a heart-friendlier treatment. Because no matter how low your blood sugar gets, your heart should never be the price you pay to control it. And now, let's move on to another familiar group of medications, often taken before bedtime, but ones that can cause your heart to fall asleep in a way that's anything but safe. Medication 3, sedative sleep aids. When a gentle night's sleep ends up tiring your heart. Getting a good night's sleep is something we all wish for, especially as we age and our bodies start to protest those long, restful nights we once had in our youth. That's why many older adults turn to sedative medications like zolpidem or diazepam to help them sleep deeper and longer. But here's the thing. These pills don't just make you sleepy, they slow down your entire nervous system, including your heart rate and blood pressure. At first, it may sound relaxing. But for an aging body, having your cardiovascular system forced to slow down can be a double-edged sword. One of the most common risks is sleep apnea, a condition where you may stop breathing several times during the night without even knowing it. And each of those moments acts like a silent punch to the heart, increasing the risk of arrhythmias and blood pressure spikes. What's more, sleeping pills can interfere with heart medications, like beta blockers, reducing their effectiveness. And if you've ever felt dizzy, confused, or nearly fallen while going to the bathroom at night, the real reason might not be your age. It might be the sleeping pill. I understand that insomnia is a real issue. But relying on sedatives long-term is like taping over a fire alarm. You might sleep through the night, but the danger is still smoldering. Talk to your doctor about safer alternatives, maybe herbal remedies, sleep therapy, or other natural options. And the next medication I'm about to share may surprise you. It's commonly prescribed to improve mood or relieve chronic pain, but it can quietly disrupt your heart's electrical activity. Dear friend, if you're still watching the video at this point, thank you for sticking with me this far. I truly appreciate and value that. Please leave the number 3 in the comments so I know I'm not speaking alone. Medication 4, tricyclic antidepressants. Balancing emotions but possibly throwing your heart off rhythm. Tricyclic antidepressants, also known as TCAs, used to be a common choice for treating depression, anxiety, and sometimes even chronic pain. Drugs like amitriptyline or nortriptyline were once seen as magic pills for emotional heaviness or unexplained persistent pain. However, in people over 60, these medications can deeply interfere with the heart's electrical conduction system, increasing the risk of arrhythmias, low blood pressure, and in rare but serious cases, complete heart block. In other words, while you may be trying to balance your mood, your heart rhythm could become unexpectedly unbalanced. This is especially dangerous for people with a history of arrhythmias or a naturally slow heart rate, since TCAs can quietly make things worse without clear warning signs. What's more, these drugs can cause dizziness, balance problems, and falls, which, at our age, are things we want to avoid at all costs. And sometimes, even low doses taken long-term without close monitoring can lead to harmful effects. Nowadays, there are many newer antidepressants that are safer for the heart and have fewer side effects for seniors. Unfortunately, some doctors still prescribe older medications out of habit or concern over treatment outcomes. If you're currently taking a tricyclic antidepressant and experiencing unusual fatigue, lightheadedness, or irregular heartbeats, don't ignore it. Talk to your doctor about safer alternatives that may be more suitable for your body today. Coming up next, you'll be surprised by a medication that seems harmless, often used for colds or allergies, but it may be making your heart race without you even knowing it. Medication 5, decongestants. Clearing your nose doesn't always mean clearing your heart. Beware the hidden side effects. Decongestants like pseudoephedrine or phenylephrine are commonly used when you catch a cold, suffer from seasonal allergies, or experience uncomfortable nasal congestion. They're found in many over-the-counter medications and have become a kind of winter companion for many seniors. However, there's something most people don't realize. These medications work by constricting blood vessels in the nose to reduce swelling and open up your airways. The problem is they're not selective. They constrict blood vessels throughout your entire body, including the ones that supply your heart. And the result? Increased blood pressure, and your heart has to work harder to push blood through narrowed vessels. For younger people, this may not be a big deal. But for those over 60, especially if you already have heart disease or high blood pressure, it's like forcing your heart into a marathon it didn't train for. You might feel jittery, experience a racing heartbeat or restlessness, and assume it's just fatigue or anxiety. But in reality, that's your heart ringing the alarm bell. Another thing to note. Many people believe that over-the-counter automatically means safe. But the truth is, your body at 60 plus doesn't react the same way it did at 40. What was once safe can now carry much greater risk. If you find yourself relying on decongestants frequently, read the labels carefully, consult your doctor, and consider gentler alternatives that are friendlier to your heart. Next, we'll explore another group of medications commonly used to treat acid reflux, but when used long-term, they may create heart problems you'd never expect. Medication 6. Proton pump inhibitors PPIs. They extinguish stomach acid but may weaken your heart. Proton pump inhibitors, or PPIs, are a popular group of medications used to treat acid reflux and heartburn. Familiar names like omeprazole or pantoprazole are often prescribed or even purchased over the counter, and many seniors treat them as an essential part of their breakfast routine. These pills work by reducing the production of stomach acid, helping relieve that burning discomfort. But what many people don't know is, stomach acid also plays a crucial role in absorbing essential minerals, especially magnesium. A magnesium deficiency doesn't just cause fatigue or muscle cramps. It can also lead to irregular heart rhythms, weaken your heart muscle function, and disrupt the electrical signals that keep your heart beating properly. To put it humorously, you may be putting out the fire in your stomach but accidentally leaving your heart scrambling for power. That's not all. PPIs can also disrupt your gut microbiome, leading to chronic inflammation, which in turn contributes to various long-term conditions, including heart disease. What's more, many people use these drugs not for weeks, but for years. If you've been taking PPIs regularly, especially after the age of 60, take a moment to reassess whether you're just masking a deeper issue causing your acid reflux. Treating the symptom is one thing, but keeping your heart strong is what truly matters in the long run. And now, we arrive at what many consider the most dangerous medication on this list. Not only is it widely prescribed for heart conditions, but without close monitoring, it may be the very reason your heart is slowing down. Too much? Medication 7. Calcium channel blockers. Designed to lower blood pressure, but sometimes they slow the heart down too much. Calcium channel blockers are a group of medications commonly used to treat high blood pressure, angina, and arrhythmias. Well-known types like verapamil or diltiazem work by relaxing the blood vessels, helping to reduce the heart's workload and improve blood flow. Sounds perfectly reasonable, doesn't it? But here's the issue. For older adults, especially those whose heart function is already mildly impaired, some medications in this group can make the heart beat too slowly, to the point of causing dizziness, fatigue, or even fainting. Think of it like this. You're driving an old car and calcium channel blockers are constantly pulling the handbrake. The result? The car sputters and struggles to move, and in this case the heart starts dozing off halfway through the drive. Besides slowing your heart rate, these medications can also cause leg swelling, shortness of breath, and may interact with other drugs commonly used by seniors, increasing the risk of electrolyte imbalances and other cardiovascular complications. What's worrying is that symptoms like fatigue, sluggishness, or swelling are often written off as just normal aging, so nobody thinks to review the medication list. That's exactly why monitoring this drug group is especially important and should never be taken lightly. I'm not saying calcium channel blockers are bad, but if they're not prescribed and monitored carefully, they can worsen your heart condition rather than help it. Dear friend, if you're over 60 and currently taking any of the medications we've just talked about, I'm not asking you to stop them immediately. And please, don't toss your pill bottles in the trash right after watching this video. Your heart doesn't need that kind of shock. Instead, what I truly hope is that you'll sit down with your doctor, ask the right questions, and actively monitor even the smallest changes in your body. These medications were originally developed to help, not to harm. But if taken long-term or without close supervision, even a trusted companion can turn into a source of stress for your heart. As a heart surgeon, I've seen too many elderly patients end up hospitalized, not because of disease itself, but because of the long-term effects of medications they've been on for years. My message is simple. This isn't about fear, it's about awareness. Not about confusion, but understanding. And above all, you have the right to ask, to understand exactly what you're putting into your body each day. Your heart has been with you through decades, through every worry, emotion, illness, and life pressure. So it deserves to be heard, protected, and cared for, especially after age 60. The best part is, you don't need to be a doctor or a medical expert. You just need to be someone who understands your own body and who's brave enough to ask questions when something doesn't feel right. Remember, making the right decision about medication today could help you avoid serious risks tomorrow. If you found this video helpful, don't forget to hit the subscribe button and turn on the notification bell so you won't miss any upcoming tips on senior health. Every week, I'll bring you practical, easy-to-follow advice to help you live healthier and stay in control at any age. Thank you for spending your time with me all the way to the very end. I wish you a strong heart, a positive spirit, and a full life, no matter your age. See you in the next video.